Hi, I'm Denaya,
Alea,
Tamara,
and Labella,
and we're from the Med Tech program. We study pharmacology.
And this is our pharmacy lab.
We all use over-the-counter drugs like Tylenol for pain, Claritin for allergies, omeprazole for heartburn, and Robitussin for cough. They're very easy to buy but very strong when used. Today we're going to be going over the drug facts labels to help you get the relief you need without the risk.
First, we're going to start off with Tylenol. When you get a drug, you want to make sure you look at the directions for use and the active ingredients. The active ingredient is acetaminophen, which is also the generic name for Tylenol. So you take Tylenol for a headache, Midol for cramps, Dayquil and NyQuil for cold and flu. You just took acetaminophen 4 times, which could also lead to a big risk called liver toxicity or death.
Now we're going to talk about Claritin, which is used for allergies. Claritin is an antihistamine and the active ingredient is loratadine. The directions for use is 1 capsule daily, so do not exceed that amount. When taking Claritin, you shouldn't take other medications with loratadine or other antihistamines like Benadryl. Taking more can increase the dose and lead to serious things like seizures or even death.
Next we have Prilosec. The active ingredient in this is omeprazole. This treats heartburn and acid reflux. Some misuses of this is using it for instant relief. This takes about 1 to 4 days to fully kick in, which could lead to taking more than needed, which could lead to stomach problems or worse.
Lastly, we have Robitussin, which is an antitussive drug used for cough and flu-like symptoms. The 2 active ingredients in this is acetaminophen and dextromethorphan. Don't take more than 6 doses in 24 hours. It could be very severe. If you take this for cough and this for pain, then you will be taking double the acetaminophen, which could cause liver toxicity. So just be cautious when taking drugs.
This concludes our capstone. When taking medications, please make sure to read the drug fact labels and search for the active ingredient, because taking drugs with the same active ingredient can lead to things like a possible overdose. Also, please keep all of these drugs out of the reach of children. If you or someone you know has taken too much of a drug, please contact the Poison Control Center at 1-800-222-1222.